I'd like to welcome Jeremy Hughes, who's the Chief Executive of the Alzheimer Society. Thank you very much for coming along. But I was wondering if you can give us a background in terms of how you got into this job as Chief Executive of the Alzheimer Society, you know, what your approach is, just basically your journey.
Okay. I'll give you a little bit of my journey. Let me give you two things which I suppose were defining factors for me. If you go right back to when I sort of left school and then went to university, which is often for many of us when things hit you, and it's always, as far as I can see, it's accident rather than design. It's actually your career so often is inspired by the teacher you liked who taught well, rather than the subject you were naturally going to be good at. So, you know, I have never been interested in French because I had a lousy French teacher, but not because I actually inherently couldn't do it, I just didn't get the stimulus. And I had a stimulating teacher both around sort of history and geography and social sciences at school. And two things really happened to me that really told me that I suppose my mantra is anything's possible, or everything's possible. The first one was, which will make you quake, and looking back and it makes me quake in my shoes, but actually was incredibly formative, was at the tender age of 17, having left school, I became a community service volunteer. And having had a fairly sort of sheltered, traditional middle-class upbringing, I went and worked for a social services area team in Islington, which wasn't as posh then as it is now. And I arrived in the area office of the social services team, just around the back of the Arsenal Stadium. And sitting on my desk were 70 pink folders, and I became the legal officer responsible for the welfare of 70 old people and was responsible for monitoring them. So I had to learn quick, and actually it worked. I mean, it was incredibly risky, and in all best practice it was totally the wrong thing to do. From my point of view, in terms of what I learned an awful lot. And I learned some fairly obvious things that sometimes when you're caught up in a profession you lose sight of. So Islington Council had set up a system whereby anyone who was an elderly housebound person on their own would be given a telephone, and the rental was paid for by the council, and it was to break down their social isolation. It was great, except I observed the fact, because the bills came in to me to sign off to get them paid to British Telecom, or the post office, I suppose it was then. I realised that actually they weren't making any phone calls. So they had the phone, but nobody made any phone calls because they were isolated, and they maybe never had a phone before in their life. So what I set up, which was breaking all the rules, which I suppose is part of my philosophy, is I set up a thing called the Ring Around Club, where they all called each other. And suddenly, for these 70 people, they all stopped being isolated. And what was lovely, in the space I was there for sort of 6 or 8 months, by the end of it, not only were they calling each other, but they ended up getting together. A lot of them hadn't left their houses, and they all said, oh, we want to get together. So we laid on transport from the council, and we actually brought them all together. And it transformed the lives of those people, which included some people with early onset dementia and frail elderly people. So that was one formative experience that made me think, well, you can actually make things happen. Even if you're in an enormous bureaucracy, even if you're a 17-year-old with no experience, by sheer determination and actually being willing to think through ideas and push them forward, you can make them happen. Second thing that sort of defined the way I went is I then went to university, and I was at Oxford University and didn't actually feel particularly attuned to Oxford with the capital O and U and all the sort of paraphernalia that goes with it. So I got involved, as you do, with Amnesty at the time, because it was a nice, gentle, sort of middle-class thing to get involved with. And you adopt 3 political prisoners, one from the right, one from the left, one from the centre. And you write letters to presidents, and you think nothing will come of it, because that's sort of what you do. So I wrote my letters off, and at that time, Pinochet had had the military coup in Chile, and he had hit himself a problem because he had too many political prisoners filling up his prisons. So in a major mistake that really undermined his long-term future, he decided to commute people's prison sentences to exile. So he then created the international movement of Chilean refugees all around the world, because he sent them off to any country and received them. And at that time, Harold Wilson's government said, was it Harold Wilson? Or Jim? No, it was Harold Wilson, I think, yeah. Said, yes, we'll have them here. Or was it Jim Callaghan? One of them. One or the other. They blur Callaghan. Probably Callaghan, it's later. Wilson was earlier, yeah. So it's Callaghan. Said, we will let them come here if they can prove a connection. And this guy was a student, Pablo, was a student leader in Santiago in Chile, and the only evidence of a connection with the UK was somehow he had got hold of one of the letters I sent to him in prison saying, I've adopted you and I'm writing to Pinochet, that nasty man, to try and get you released. So he gets this letter, produces it to the prison guard, who shows it to the prison governor, who shows it to the British Embassy, and suddenly he literally turns up on my doorstep in Oxford, off the Cowley Road, and knocks on the door. Now, it's not purely coincidental because there was a refugee programme running and there was a community there, but it was just, again, a feeling that you think you're not making any difference, but every now and again something happens and you realise that you can make a bigger difference for the life of an individual or group of individuals than you would ever have imagined possible. So those have become the defining characteristics of my career, and I suppose I then almost automatically ended up working in the voluntary sector, because if you think about it, the reasons charities are set up are because they're set up by people who want to change things. If you didn't want to change anything, you would never set up a charity, because basically you're saying the system ain't working. I'm going to set up, whether it's Eglantine Jebb setting up Save the Children in the 19th century, or Thomas Bernardo setting up Bernardo's, or Leonard Cheshire setting up Leonard Cheshire. You look at all these individuals over history, and they've all basically said, I don't care about the rule book, I'm going to change society. And so I suppose I found a natural home in charities because that's their philosophy. I would add as a caveat, part of the problem charities sometimes have is they lose that as time goes by, and they lose that sort of crusading, which to me is the principle, the reason charities exist, the reason people give money is to make a difference. And it worries me when charities actually lose that sort of cutting edge and become more traditional or more establishment than they should.
So when you came into, you saw the Alzheimer's Society, the job being advertised, you get the job, and there you are, day one. What's going through your head in terms of what do you think the major challenges for our society from dementia, and how did you start to position the Alzheimer's Society in terms of responding to some of that?
Well, I suppose what I saw coming into the Alzheimer's Society was firstly an organisation that wanted to do what I just described, wanted to make a difference. So it wasn't just wanting to run services, or wasn't just wanting to run a helpline, but it actually wanted to make a step change and go further. We had examples of people who were saying that they had Alzheimer's disease. Ronald Reagan, said he had Alzheimer's disease. Margaret Thatcher always seemed to deny it, but Ronald Reagan was willing to admit it. Terry Pratchett was going public and saying, I've got Alzheimer's, and so on. So you were beginning to see a change of attitude. And it seemed to me there was an opportunity there to actually contribute to a step change. And then when I started digging into it, two other things became apparent to me. One was, my God, how bad we were. So as we know, still today, for less than half the people with dementia to actually get diagnosed at all before they die, if that was cancer and half the people with a cancer tumour died of their cancer before they were diagnosed, it would be all over the front page of the Daily Mail every day of the week. It just wouldn't be allowed to exist. But we've somehow accepted an underdiagnosis of dementia and even a late diagnosis of those who do get diagnosed for a long time. But we've also, I think, realised that it's not just about medical interventions that can make a difference. I had a couple of GPs I spoke to a couple of years ago, and one of them said, there's no point diagnosing people because nothing can be done, which was such a narrow medical model as to what diagnosis is about. Because yes, there are limited drug interventions. There are actually some that make a difference now, but there's not a cure. You can't go for surgery and get rid of dementia. So the idea that we had to overcome was this idea that nothing could be done. The second GP I spoke to, and these were two very close together in time, so I remember the two together, was somebody said, oh, there's no point diagnosing people because all it does is worry them. Which again seemed to me a very negative attitude, that somehow you don't tell people what's wrong with them because you fear you might upset them. And every single person I've met has taken, and their carers have said, actually, getting a diagnosis wasn't easy, and it had lots of problems, and it was very traumatic in terms of the change of life and the risk of losing a driving licence and the problems for insurance and everyday practical things. But overall, I've not yet met a single person who says, I really am sorry I was diagnosed. I would have been much happier not knowing I had Alzheimer's or another form of dementia. So it's that combination of factors, seeing the fact that there was beginning to be a tide turning and there was an ability to make something, and I suppose it was seizing that opportunity and saying, yes, we can chip away at the edges and make a significant change.
Which bits of the strategy do you think are the most incisive? There must be one bit of it you think, actually, this is where we really need to push in order to make a change.
The thing that's impressed me is the Dementia Action Alliance, because it would have been very easy as the spotlight was more on dementia, to actually have said, we're going to keep it all to ourselves. We're going to actually control everything. Alzheimer's Society, is in a unique position because we, in a sense, don't have many competitors. We've got, the only other disease-specific charities are Dementia UK, which is very small, and has about 150 now, 100 to 150 Admiral nurses who do great work. But I mean, that's 150 Admiral nurses compared to the 9,000 staff and volunteers that Alzheimer's Society have. It means it's poles apart in terms of scale. And Alzheimer's Research UK, which fund biomedical research, and pretty much that's it. So we had this unique space where, unlike in cancer, where you had Macmillan, Cancer Research UK, all the single-issue cancer charities and so on, we had it to ourselves. And we could have said, OK, we're going to keep it all to ourselves, and we're going to grow, and we're going to develop. I think the brave and the right thing to do was what we said, which is that we're going to create an alliance where we will be the engine room, we will be making sure it works, but it will involve everybody else in making that difference. The important thing in the Dementia Action Alliance is twofold. One is that it brings together on a national basis all the health and social care organisations that are doing something about dementia. So all the Royal Colleges, all the government departments, the Quangos, the arm's length bodies, the charities, the care home providers, etc. They're all in there. And we've now got, from starting with 40, the month I arrived, we launched it, we've now got 140 organisations. The other thing that I think is significant, because it's a journey, so we are far from being there yet. And I think it's a journey for all of us, and it's a real challenge, actually, for Alzheimer's Society as everybody else, is how do you properly engage with people affected by dementia? Because all our work should be informed by and referenced back to people with dementia and their carers. And we've done quite well, I think, in the National Dementia Declaration that was launched in 2009 alongside the National Dementia Strategy. There's a set of what we call I statements, which is how people want to live with dementia. And it says, I want to be able to go out into the community. I want to be able to make choices. I want to be well informed. And that was drawn out of work where we actually researched quite carefully, it was Shubi and others at the time, but researched quite carefully how to make sure that those statements were well grounded. I think our challenge now is how do you maintain that sense of engagement as the movement grows, because it's very easy as you get a room full of professionals to crowd out the voice of the consumer, particularly when you're talking about people with dementia for whom it's more difficult often to participate in those discussions. And at Alzheimer's Society we bend over backwards to make sure we're involving people with dementia. But if I'm honest, one of the challenges we have at the moment is how do we properly engage with people with later stage dementia, and how do we make sure their voices are heard? How do we work with the care home providers, where we know 80% of the residents of nursing homes and care homes are people with dementia, but they're not engaging with the people in those homes very well, and we're not helping them yet. So there's a challenge there.
So a lot of people in the room here are early implementers, people who are out there creating new services, innovating, thinking about how to provide something which fits people's needs. I mean, we are in a political world of people talking about integrated care the whole time. I'm just wondering how you see the model for showing the way in terms of integrated care.
I mean, something I've learned over the years is that actually it's culture, not structure, that matters. And part of the big mistake that sort of secretaries of state repeatedly make is that they all come and try and alter the structure of the NHS or the social, well, they don't actually bother much about the social care system, so they all try and alter the structure of the NHS in order to drive change. But structures won't work unless people want them to work. And if you keep changing the structure, you just get totally frustrated. And actually, the natural tendency is just to keep your head down and keep out of the way, because you actually know that in 2 years' time it'll blow over and somebody else will come along with something else. So you sort of burrow away and do your own thing. The interesting thing is where you get the culture right and you actually get people wanting to work together and wanting to make a difference for people with dementia by, on the ground integrating service provision, not with some great fanfare, not even by working through, which I think is an opportunity, but not even by working through health and wellbeing boards and empowering them, and by CCGs working together. You can actually just, at the coalface, start talking about how do we actually bring those elements together that all make a difference. So for us, we've developed, and very successfully, and it's been evaluated and shown to work, the dementia advisor role. So this is a sort of new kid on the block in the last 2 or 3 years, where we've actually got people who are sort of care navigators, if you like, for people with dementia. And importantly, they are also able to understand the comorbidities that often people with dementia have. But the thing that can deny people access to good support across all their conditions can be the issue of dementia. So, if you can't communicate, if you're not understood by your GP, by the practice nurse, by the person in the hospital, then it's no good you having diabetes if they can't actually relate to you because they're not getting past your dementia, as it were. So those care navigators are really important. But some of the interesting, innovative work we're now doing is saying, well, where do those care navigators work? Where do those dementia advisors work? Do they work in a hospital setting? Do they work embedded in a GP practice? Do they work in the community services? And the forthcoming, soon-to-be Social Care Act will be really interesting because it puts a duty, a legal responsibility on local authorities to provide information, which hasn't been there before. So how do we tap into that? How do we seize that opportunity?
So what do you think the role of the voluntary sector is now and as we go forward? But also, how can the people in this room, or how can the statutory sector actually work with the voluntary sector better?
For me, the resource we have to work with you of our local Alzheimer's Society groups, the fact that we've got 7,000, as I said earlier, we've got 9,000 staff and volunteers, but 7,000 volunteers and 2,000 staff, and those are volunteers actively involved in delivering services. On top of that, on the Dementia Friends programme, so far we've done face-to-face awareness sessions through volunteers to 75,000 people, which is a phenomenal number of people in the past year. We're now going to do it in companies, so Marks and Spencer's are going to do it with all their workforce. Starbucks just committed last week to becoming a Dementia Friend organisation, and we're going to take it into their organisation. But the interesting thing is the volunteer emphasis. So the way Dementia Friends happens is that it's volunteers who train up for a day to become a dementia friend. They give up a day of their time. They train up in sessions run by Alzheimer's Society, and then they go and run voluntary sessions in their community. Those 4,500 Dementia Friends champions, and there'll probably be twice as many in a year's time, will also want to do something else. So for all of you, there's a resource there, and the challenge you need to give back to me is, so how can Alzheimer's Society facilitate the linking together of this community of interest from volunteers, this community of interest from people like the Dementia Action Alliance in Crawley, where you've got all these people wanting to play their part. How do we make that work for you in a way that it becomes an opportunity, not a burden? It actually becomes, because sometimes you can have these great initiatives and they then become a sort of just a problem in themselves. So we have to work it out right. And I think the people in this room, what's exciting for me and why I was so keen to come is that as the sort of early adopters, the innovators, and by you coming together today, so you sort of learn from each other and establish a sort of ongoing network of contacts that I'm sure you will sustain and continue over the years. You can then be both innovating, but then spreading that best practice at the sort of grassroots level without, as I said a minute ago, without having to get permission from some structural organisation at the top.
And on that note, we shall leave it there.
Great.
Jeremy, can I thank you very, very much for backing?
Thank you.